Hi everybody, welcome again to another episode of Hair Talks by Terra Medical, and my name is Dr. Joshua Chong. Today we'll be talking about FUE, or Follicular Unit Excision and Extraction. Now, what this nomenclature suggests is that individual hair follicle units are excised using a sharp instrument or blunt instrument and extracted out of the scalp before it's then implanted into areas where we're interested in creating a thicker, denser appearance. The benefit of doing FUE involves us not having to cut out a strip of tissue, also known as LSE or linear strip excision type of hair extraction method. This will result in us having to stitch the wound up and have variable degrees of a linear scar across the back of your head, sometimes limiting certain men's hairstyles. This also avails us to a new technique called long hair FUE, and this requires newer equipment that's catered especially to the long hair aspect of the FUE harvesting process. This allows us not to shave any of the donor area, and this would particularly benefit our female patients who do not want to have any area of their scalp shaven. Patient selection is important for this bit. Not everybody is suitable for a long hair FUE procedure. So I'm going to take you through a step-by-step process of how we do it here at Terra Medical. So this is our prep room. So when patients first come in for the surgery, they'll be seated in this chair, assessed properly to make sure that there's no contraindication to surgery such as massive infection on the scalp, bad dandruff, seborrheic dermatitis, etc. Once they're confirmed to be eligible for surgery on that day, in a typical short hair FUE transplant procedure, we will start to shave the donor area down. Once that shaving is done, we'll proceed to have him lie down in this bed, or him or her, and we'll then shampoo thoroughly the hair to make sure that it's a nice, clean environment for us to work with. The next step of the procedure would be to get our patient into this beautiful operating room with a wonderful view, as you can see, of Orchard Road. Then our patient lies down in the chair and we do a timeout. So that involves us checking that we have all the patient's correct details, surgical plan, and the surgical strategy that we're going to adopt that day. Are we going to harvest first, or are we going to make sites first? And we'll talk about the harvesting process right now. So ensuring that a good graft yield is gotten, we spread the harvesting out throughout the entire donor area. So we mark that out with a surgical pen, and we use a punch that's of good quality. The one that we are currently using is the War Duo punch. It's a wireless handpiece and works like a charm. It penetrates the skin very gently, allowing us to have entire hair follicle units extracted smoothly and very safe to use. It also has a very interesting healing profile in the sense that patients tend to have smaller wounds after the procedure. This little fella here is called a Mantis microscope. It's customized for hair transplant purposes. So when we are doing an FUE procedure, the grafts will come out as hair follicle unit grafts. So they will contain either 1 hair, 2 hair, 3 hairs, sometimes 4 hairs. Place them on a cutting board here. Someone looks through these lenses and then sorts the grafts out into singles, doubles, triples, etc. And place them into a holding solution, which we then put in cold storage so that the grafts have a higher survivability. Now that all the grafts have been checked and our patient has had his lunch break, toilet break, he's back in his chair for us to now create recipient sites. So what recipient sites are basically little incisions, either using a needle or using a sharp blade of varying sizes which are matched to the grafts that the patient has, and they're then made in a strategic fashion based on the hairline design so that this can house the grafts snugly to ensure a good density as well as a very natural looking hairline, and lastly that they will fit snugly so that they don't pop out overnight if the patient accidentally touches it against something, for example. And the final step of the process would be to get those grafts into the recipient sites. So if we do make pre-made sites, we tend to get either a team of technicians to do the implantation, or we would do what we call implanted implantation. So implanter is a device, either sharp or blunt, where we load hair follicle grafts into and directly place them into the scalp using a mechanism. And this is known to actually be more friendly to the bulb, the very sensitive bulb area of the graft. As a quick recap, there are 5 steps to an FUE hair transplant procedure, and that they are patient preparation, donor harvesting, quality checking of the grafts, making recipient sites, and lastly, placement or implantation of the grafts. Now, I want to emphasize a little bit about aftercare post-FUE hair transplant, and this is of paramount importance to ensure maximal graft survival rate. And this aftercare period typically lasts for 7 days after the surgery, so set aside some time for yourself to recover. The first bit of aftercare would usually involve keeping the grafts really hydrated, and we would usually issue what is necessary for our patients, which is a trade secret, to keep their grafts hydrated. They're going to have to be spraying every few minutes, few hours onto the recipient area to make sure that these grafts actually achieve the ability to attach to the skin and the blood flow from the surrounding skin so that they are able to receive nutrients, oxygen, and whatever is needed for the grafts to then grow. We've come to the end of our video. Thank you very much for your attention. If you like this video, please remember to click like and subscribe to our YouTube channel and to leave any questions in the comment section below. And I'll see you next time for yet another episode of Hair Talks by Terra Medical.